One of the things that has one of the unique aspects of the Better Beginnings project is the fact that it was announced by the government as a research demonstration project. It was not just a demonstration project, but a research demonstration project. And all of the projects that were selected, the neighborhood projects that were selected for funding, had to agree to participate in the research.
One of the key distinguishing features of Better Beginnings, Better Futures is the involvement of community residents as partners in every aspect of the initiative, including the research, with some residents hired to work with the site research teams.
And those people were employed by us, but they lived and worked in the communities and did the research. And for the first several years, they spent a tremendous amount of time collecting information on the processes that really contributed to the development of the programs themselves and the management structure.
You know, I lived in the community for 8 or 9 years and was very, very excited to be part of this groundbreaking 25-year-old Canadian-only longitudinal study, so it was very exciting for me.
The Better Beginnings, Better Futures team conducted 3 types of research. Outcome research, primarily quantitative; program development research, primarily qualitative; and economic analysis. Parents, residents, teachers, and service providers were involved primarily through research committees established in each of the communities.
We made it, kind of front and center of everything that we did, so that it wasn't research is over on the side. It was integrated into what we were doing.
I liked how the research team involved teachers right from the beginning in terms of giving feedback on the programs, but also having a chance to look at the questionnaires and maybe suggest more appropriate ways of asking questions.
The research committees were part of the management structure in each of the communities, and they were set up to review all of the research plans and to contribute to their development. So the research development process was quite interesting, actually, in Better Beginnings, because it wasn't laid on by the government. It wasn't laid on by us, the research unit. It wasn't determined solely by the communities. It actually resulted from sort of the ongoing negotiations and discussions of all 3 of those groups.
Information for the Better Beginnings research was collected through several sources. The data were collected when the children were in junior kindergarten, senior kindergarten, grades 1, 2, 3, 6, 9, and 12 for children in the 3 Better Beginnings sites, as well as 2 demographically matched comparison sites.
The researchers recruited just about 1,000 children from the 3 Better Beginnings communities, and then they found 2 communities that were sort of like Sudbury and Cornwall and Etobicoke, and those were the comparison communities. So they recruited 1,000 children, and these children were all 4 and 5 years old, about 14 or 15 years ago.
Examples of evidence that Better Beginnings has been effective can be seen in multiple areas, including child outcomes, outcomes for parents and families, and neighborhood and community outcomes. Child outcomes include improvements in children's social skills, improvement in self-control, improved parent ratings of children's overall health status, reduced hyperactivity, and lower rates of use of special education services.
If I didn't come to the program, I think I'd either be at home, sitting down, doing nothing. I think here is a lot more fun and you can do a lot more things. I've made quite a bit of friends.
Parent and family outcomes include a reduction in maternal smoking, improved parental social support, and improved family functioning at particular follow-up time periods, specifically grades 6 and 9. Neighborhood and community outcomes significantly higher levels of parental involvement in neighborhood activities, a greater sense of community involvement, and a pattern of greater neighborhood satisfaction than parents from comparison sites at the grade 6 follow-up. Economic analyses showed that, based on the average of $2,991 spent per family for participation in Better Beginnings, Better Futures programs, the government has saved approximately $4,569 per family by grade 12 on other services including education and social services. Therefore, for every $1 spent by the government, there was a savings of approximately $2.50.
The positive outcomes in favor of the Better Beginnings children and family actually strengthened over time, so that by grade 6 and particularly grade 9, the children academically were doing better than the children in the comparison communities. Their families were functioning better. The children showed less use of special education. They did better in school. Their teachers saw them as being less hyperactive, as showing fewer emotional problems. And these positive outcomes were stronger at grade 9 than they had been earlier. By grade 12, we still saw positive outcomes in favor of Better Beginnings kids. We saw that their parents were less involved in the social welfare system.
We believe that, in implementing this research, lessons have been learned that can help others evaluate their own initiatives. These lessons include that it's important for research and evaluations to be built in right from the beginning, and that the researchers take the time to carefully choose the research design, research approaches, and instruments in consultation with the local communities. It is important to involve residents, teachers, and service providers in the research process to enhance the research and to increase local ownership. Qualitative research is a valuable addition to research on community-based prevention programs and should be mixed with more traditional quantitative outcome research. The research needs to be well-funded. It is important to conduct an economic evaluation of prevention programs for children, and it is not enough to do the research and report it in scientific journals. The knowledge gained from research needs to be transferred to government to inform public policy.
Translating research to policy is always a tough call, and many researchers are reluctant. Many university-based researchers are reluctant to engage in that kind of research because it's oftentimes very difficult to publish or to publish quickly. We've been at this. I mean, we had our biggest publication of our research published in 2010. We started this research in 1991, but it's allowed me to maintain this sort of dual track of academically honest, solid research informing public policy. We were funded, the Research Coordination Unit, were funded separately from the communities. So they received their project funding directly from the government. We received funding directly from the government to implement and carry out research and evaluation of the Better Beginnings project from day one. So in fact, we had to compete for the contract as well. There were, I think, 7 or 8 other groups that submitted for the research proposal. We were selected, and funding started. It was a multidisciplinary group of researchers from 5 different universities in Ontario, because we had someone from nursing, a nutritionist, we had sociologists, we had people from education. Because of the ecological nature, community psychologists, because of the ecological nature of the Better Beginnings initiative, we needed people from a variety of backgrounds to help develop and carry out and analyze the research results. Also, we were contracted to provide answers to 3 main questions, or to do research in 3 major areas. The first one was to collect information about how the programs actually developed the projects developed in each of these 8 communities. Because the government wanted us to learn, or they wanted to learn, what works, what doesn't work, what are the developmental processes that these organizations go through in terms of setting up their programs and setting up their organizational structures, how did they select the programs, how did they decide to make decisions on their committees, and so forth. So the first thing we did was to hire and train researchers in each of the communities on qualitative, descriptive, field note-taking research. And what they would do is to sit in on every committee meeting with their laptop, and they would take field notes. They would carry out interviews with people. They would monitor sort of reports from that were generated in the communities to try to get a good feel for what exactly was happening in each of these sites with regard to project management, with regard to resident participation. How were they trying to get residents to participate? What were the successes and failures that they had in that regard? What was going on in terms of this integration of services or collaboration with other agencies? What was working in the communities? And the researchers would write reports. Every year they would write a report on these different aspects of the project model. So they would write a report on resident participation. They would write a report on service partnerships. They would write a report on management structure. They would write a report on budget and what the costs were. So I mentioned before that it took 2.5 years for the communities to get everything organized to the point that the outcome research was ready to start. But during that 2.5 years, these field researchers collected a tremendous amount of information about the processes that the sites went through. And I'll talk a little bit more about that later on in terms of what that allowed us to do. But each site would write a report, and then we would have those reports fed back to the site research committees for them to review and see if there was anything missing or anything they considered to be inaccurate. And then we would take those reports from each of the 8 communities and write a synthesis report, common findings across all of them. All of these reports are on our website for those of you who might be interested in more of the process kind of research that went on. And the researchers continued to do that kind of research for another 2 or 3 years while the programs were being implemented as well. That's a fairly unique aspect of research of social programs. Oftentimes the focus is almost exclusively on what's the impact, what's the outcome. Did it have a positive effect on children, or did it have a positive effect on parents, or whatever? But not how did it develop, how did it get there? So that was the first area that we had to do research in, and we had to demonstrate on our research team that we had people that were expert in qualitative research methodology. Secondly, outcome evaluation. What were the impacts? Did it have a positive impact on children? All these different aspects of the child's development. Did it have positive impacts on parents? Did it have any indication of any changes in the community, positive changes in the community? Now that's more traditional outcome evaluation that you're probably used to. But again, given the ecological model of the Better Beginnings initiative, we had to have outcome evaluation in all different aspects of the child's functioning, of parent functioning, of family functioning, of communities, engagement in the community, and so forth. So you can imagine the range of measures that we needed to collect in order to be able to make some sort of intelligent conclusion about the impact of the initiative on all of those different players. Thirdly, to do a cost analysis. The government wanted us to collect information on how much these projects cost, and they also wanted us to collect information on whether or not there was any reduction over time in the use of government services that resulted from this project, to do an economic analysis, essentially. There are very few of these done in Canadian programs. There are very few of these economic analyses done on any kind of program. Most of what we have in the area of early childhood development has been done in the United States and usually started 20 years ago, and usually with very, very disadvantaged African American populations. So the generalization of those studies to the Canadian context is always somewhat questionable or problematic. So those are the 3 things that we were funded as a research, we call the Research Coordination Unit, to answer. What we did was once we collected all this information for that first 2.5 years, We then collected baseline information. We recruited a longitudinal birth cohort. Everybody know what that is? In the younger sites, in the 0 to 4 sites, we recruited we tried to recruit all the children that were born in a year. And we tried to get, we got about 70% agreement. So of all the kids that were born in each of the 0 to 4, the younger neighborhoods, we recruited all the kids that we could that were born that year into the longitudinal research. Because the intent was, as I mentioned before, the intent was to follow these kids up for 20 years to see what the long-term outcomes were, not just the short-term outcomes. Right, right. It had nothing to do with program participation. It had to do with whether or not they were born in that neighborhood that year. And the year was 1994 for the birth year. For the older child sites, the 4 to 8-year-old sites, we recruited children that started pre-kindergarten or junior kindergarten that year. We tried to get all of them who turned 4 from the 3 communities. We also identified 3 communities that seemed sociodemographically similar and culturally similar to the Better Beginnings that were not receiving funding to act as comparison or control communities. And we recruited children at birth and 4-year-old children from those communities to act as comparisons over time. Does that make sense? So it was not a random assignment, but we identified the communities after the Better Beginnings communities were identified. So we had this longitudinal sample of children at birth or children, 4-year-old children, both in the Better Beginnings sites and in the demonstration sites, and we followed those children through 4 years of programming. So the children that were born there were programs in the younger communities for children 0, 1, 2, 3, and 4. In the older child communities, there were programs for children 4, 5, 6, 7, and 8. 4, 5, 6, and 7, from junior kindergarten to grade 2. And we followed these children and their families for that 4-year period as they developed and went through the 4 years of programming. Is that clear? And then at the end of that, we collected our final outcome measures, and then we analyzed them and reported them as short-term findings. So these are the findings that we got immediately after the 4 years of program involvement of this group. And we published these in the year 2000. We finished the data collection in 1998, I think. And when you go to our website, you'll see something that'll talk about short-term findings, and that's the findings of all the analyses we did immediately after completing 4 years of potential program involvement. What we found was the qualitative descriptive research that we did indicated that all 8 sites were successful in developing universal comprehensive prevention programs. They were all successful in offering a variety of different kinds of programs for children, families, and for the community itself. We also found that they formed successful partnerships with service providers and that they were successful in involving local community residents. These were major aspects of the Better Beginnings model that the communities were asked or funded to develop, and they were successful in doing that. Also, we found at the end of that 4-year period that there were reduced children's emotional problems and improved social skills in the measures we took of the children's development over those 4-year period, improved parents' health promotion and disease prevention behavior, less smoking, for example, in parents. Improved children's nutrition. One of our researchers was a nutritionist from University of Guelph, and we collected food diaries and analyzed what children ate over a 3-year period, and found that the Better Beginning site kids were eating better than the kids from the comparison sites. When I talk about an effect, being positive, like improved parents' health promotion or reduced child's emotional problems, it had to occur in all the sites, not just in one. So we had to see sort of a general trend across all the sites. Otherwise, you get lost in this terrible morass of finding a positive effect in one site and not in another site, and things just become crazy, especially when you have over 100 measures to analyze. We also found reports of enhanced neighborhood perceptions of neighborhood safety and satisfaction with the Better Beginnings neighborhoods relative to the comparison sites. We were funded to do not just short-term outcome research, but also long-term longitudinal outcome research, as I mentioned. So what we did in the younger sites, in the 0 to 4-year-old sites, is we collected information from our research sample when the kids were in grade 1, and then again when they were in grade 3. So this was 2 years after ending the possibility of program involvement, 2-year follow-up, and a 4-year follow-up. Okay, that's sensible? What we found was no positive outcomes for children or parents at either grade 1 or grade 3. This was not good news. This is not what we had hoped to see, but this is what we found. We found that there were positive effects on children and parents at the end of the 4 years when the kids were 4 years of age, but when we followed them up for 2 and 4 years later, we didn't see any lasting effects. Now, this is not unlike research that comes out of the U.S. in terms of the lasting effects of preschool on Head Start kids, for example, or research done in disadvantaged communities, where oftentimes you'll see differences of a particular preschool program showing up at school entry, but 2, 3 years later, you don't see any effects. How many of you read the article in Maclean's recently about full-day kindergarten doesn't work? Did you see that? And all of the research that was quoted in that article was essentially 20-year-old U.S. based research. And this point was made by a number of people in looking at that. There hasn't been a lot of research done on this topic, longitudinal research, follow-up research done on this topic in Canada. But what we found was similar to what some of the studies in the States have already found. But why is this the case? There's a whole variety of possible reasons, none of which we could actually identify as the reason that we weren't seeing positive, these effects being maintained. One of the things that we thought was maybe this is just too complex. I mean, when you think about it, asking disadvantaged communities to develop project management structures and then implement programs that are going to be potentially influential on all aspects of the child's development, not just on cognitive development or language, but on all aspects of the child's development, but also on parent and family functioning, and also neighborhood change. Maybe it was just too much. Maybe the mandate was too broad. And also maybe the resources to do that were too few. And this got us interested in the whole question of cost. How much did the Better Beginnings programs cost? And could that have had something to do with the reason why the effects were not strong enough to last 2 and 4 years after children left the program? So what we started to do is to look at other programs for children 0 to 4 that have been published, that have found whether or not they found positive long-term follow-up. The first one, I don't know, is this clear enough to see? Yeah. The Abecedarian Project. How many people have heard of the Abecedarian Project? Okay. How many people knew that it ran for 5 years and cost $100,000 per child? Per child. How many people knew that? IHDP is the Infant Health Development Project, which was replicating Abecedarian with low birth weight children for 3 years. It cost $70,000 over the 3-year period. Now, both the Abecedarian and IHDP have found positive long-term outcomes. How many children were in the intervention group for the Abecedarian project? You can't answer, Joanne. How many children were in that study in the Abecedarian project? You know how many were treated in the treatment versus the control group? Yes. 50. She told you. Oh, I told you. I told you. 50. There are 50 people and 50 kids, and they were all very developmentally delayed, and a very, very intensive intervention. It was effective. It has positive long-term follow-ups, but it's for a very, very targeted, high-risk, at-risk population, very small population. CCDP I won't talk about, even though it was run for 5 years in the U.S. It found no positive effects at the end of the 5 years. Early Head Start for children 0 to 3 is just sort of starting to follow those kids up. But look at the cost of those programs. For 3 years, Early Head Start cost $30,000 or $10,000 a year. Perry Preschool. Everybody's heard Perry Preschool, right? Preschool project. I mean, most people have. 2 years of very intensive preschool experience, randomly assigned control group, run for 2 years, cost $15,000 per child over those 2 years, and has followed those children up into the 40s and is still finding positive effects. But these were extremely disadvantaged African American children in Ypsilanti, Michigan in the 1960s when this study was started. How many were in the intervention group? How many kids were in the Perry Preschool intervention group? How many received the actual Perry Preschool intervention? Anybody know? 50. A good round number of 50. Only 50 kids. You can do a lot with those kind of resources if you only have 50 kids. They had very well-trained teachers that provided preschool curriculum every day at a university preschool, and those teachers also did home visits routinely. They had positive effects on those very, very disadvantaged kids that have lasted for some time, but look at the cost. Nurse home visitation, David Old's program, nurse home visiting, the nurse, what do they call it, nurse family partnership now, something like that. It's ongoing. I think a trial is ongoing in BC as we speak. He did an economic analysis, followed up the mothers in that project, and found that there was a significant long-term lasting effect for some of the mothers that participated in the program, but only for the mothers that were extremely high risk. That is, were first-time moms, single moms, less than 20 years of age, and was there a third criterion?
Here it has to be certain before a certain number of weeks. Pregnancy before 28 weeks.
Yeah. So this is the only well-demonstrated nurse home visiting program, or home visiting program. Costs for 2.5 years intervention, $13,000 per child, per mother, per family. Sure Start, which is a Better Beginnings type project in the United Kingdom, in the UK, has been operating now for about 5 or 6 years. They have a very similar kind of model to Better Beginnings, but it costs $9,000 over the 4-year period. No, Sure Start. Yeah, Sure Start. And then Better Beginnings, Better Futures at the bottom. We calculated that the cost per child per year was $748. That's what the government allocated. That's what amounted to the allocation that the government made to these communities. Remember, I said there were about, 500 more or less in each community. Well, if you take the amount of resources that were allocated to that community and divide by 500 for the year, you come up with $748. Over the 4-year period, that amounts to about $3,000. So when I said maybe the resources were too few to make lasting impacts on the younger children, it could have been that $3,000 per child per year, for $3,000 over a 4-year period, is just not enough to create a lasting effect after the end of the program. Okay? Another thing was that in the older child sites, and I'll talk about them in a second, in the older child sites, the programs were organized around the school. In some of the programs were offered in the schools, but others were offered before school or after school, but they knew who all the children were. They could access every child. It doesn't mean that every child is going to participate in every program, but they knew who every child was, and they knew who every parent was that were in the age range in that community, so they could contact them. They could try to recruit them into programs. They could make the programs, make them aware of the fact that programs existed. They ran a lot of parent programs in the school building or before school or after school with the children. So there was this system, there is this primary educational system that they could sort of take advantage of and program around or with. There is no such universal system available for children 0 to 4, at least not in Ontario. Maybe there is in BC. Maybe there's affordable, universally affordable, accessible, high-quality early childhood learning and care programs in BC for every child. No, it hasn't gotten here yet? Not quite. If there were, just think of it, if there were a program for early childhood learning and care so that every child had the option, or every parent had the option of putting their child in an early child care program, and then in disadvantaged communities, you had $800 per family per year to add additional programming, to try to strengthen the effects of that. That's essentially what happened in the older child sites, where they were already going to school at the cost of, what, $10,000 a year for primary education. The money, the Better Beginnings money, could then be used to fill gaps or to add things for disadvantaged neighborhoods that are not there normally. It's sort of a value-added kind of thing. We don't have a system to add value to systematically for 0 to 4. So that may be another reason. There just wasn't enough participation. And in fact, we have some data that support that. If we looked at the percentage of families or children that participated in a Better Beginnings program 80 times or more over the 4-year period. Now, that may seem like a lot to you if you're thinking about some visiting program, for example. I don't know how many you get. How many total sessions would you normally get over the 2.5-year period? Would it be weekly?
I don't know.
Okay. Anyhow, 80 may seem like a lot, but think about it. These kids are going to school every day. So if they were in a preschool program or a before school program or an after school program every day for a school year for 4 years, that's well over 80 involvements. So 78% of the children in our research sample had participated in a Better Beginnings program 80 times or more. In our research sample for the younger kids, 0 to 4, only 32% had. So it's just much more difficult to access those families and to recruit them in and to get them intensively involved in programs, at least in our study it was. So that may be another reason. There's just not the kind of spread of intervention that you find in the older sites. So this gets back to the 0 to 4. This is a representation. You may have seen this in the earlier study. I think they included this graph, which is actually a graph that comes out of California, that tries to present the lack of an early childhood system, the fact that there's no highly integrated sort of a coordinated system for children 0 to 4. Yeah.
You're talking about, did any of them include child care program, like for the
Good question. The question was, did any of the programs include child care programs? The answer is they were not allowed to use any funds to fund new child care spaces. So there were no new child care spaces created. They were allowed to use resources to strengthen or improve the quality of child care that existed. So some of the sites used some of the money to employ additional ECE workers for the child care centers. Okay. This has to do with trying to get things coordinated both at the ministerial level or at the provincial level and also at the local coordination level. This is not meant to be taken like prescriptive, just sort of to state pictorially what we already know, and that is that things are pretty disorganized in terms of service coordination integration for young children 0 to 4. Once they hit 4, and once they hit the school system, it's a lot easier to coordinate things. Duh. Okay, I talked about the 2- and 4-year follow-up for the young children. For the older children, the 4 to 8-year-old children, our longitudinal sample, we followed them up in grade 6, then again in grade 9, and then again in grade 12. So this is 3, 6, and 9 years after ending program participation or involvement. What we found that all 3 of the sites demonstrated long-term positive outcomes for children, for parents, and for communities. I'm only going to talk about the grade 12 follow-up results. I could talk about the grade 6 and the grade 9. There were positive outcomes at grade 6, which allowed us to continue to collect data for grade 9. And then in grade 9, there were positive effects, which allowed us to continue funding to follow them up to grade 12. I'm only going to talk about the grade 12, but you have received a common language version of our research for grade 9 outcomes and for grade 12 outcomes, those multicolored things you picked up when you came in. That is, we took our research results and had a professional writer write them up in a way that normal people could understand. Here are just some of the effects that we found. Well, these are the major effects that we found at grade 12. Number 1, less special for use. These are measures for the use. Less special education for Better Beginnings children than for children from the comparison site over their educational career. So 13% versus 19%, it's a 6% difference. That's not a huge difference. But when you think about costs of special education, it's not inconsequential. They had higher grades in high school, the Better Beginnings did. Again, these were the older sites, so these effects had to be seen across all 3 sites in order for us to consider them to be noteworthy or positive.
On special education, is there any sense of, did that drop out at certain points? Because sometimes they get services and then they drop out and then they reappear as they're starting to go in.
All this is based on is whether or not they ever received any special education services. And we got this from school records, and we got this from parents, and corroborated that. Yeah, Barry?
Controlling for any differences between the Better Beginnings and the control communities?
Every comparison that we do, we have about 12 control variables for language, for socioeconomic status, for, I forget all the ones. We control all of our analyses for that. I don't know if is that answering your question?
There are some non-beginnings programs in the Better Beginnings neighborhood,
sure,
as well as equivalent programs in the other neighborhoods. So how is that accounted for or not accounted for?
The question was, there are other things going on in both Better Beginnings neighborhoods and non-Better Beginnings neighborhoods that would ostensibly have some impact, potential impact on children. That's true, and we studied that. We collected information about other programs, both in the demonstration and the comparison sites. There clearly were things going on, but nothing that would indicate that there were more going on in the Better Beginnings than in the non-Better Beginnings, or vice versa. Right? Because there were initiatives that come into play, like Healthy Babies, Healthy Children, which is a sort of a screening program by public health nurses that occurred in both communities. We couldn't find anything in terms of searching for additional services or programs that differentiated the two, other than the Better Beginnings funding.
78% of children in the older kids participated at least 80 times in a program. But do you have anything to say about how many times they would have participated in other programs or in the other neighborhoods in anything? Just to give an idea of participation in things?
We did. We collected that information. Part of the problem, the question was, did we collect information about other programs that they participated in? Part of the problem is that parents have no idea what a program is. They don't know if it's a Better Beginnings program or not. These data, the 78% and the 32%, were collected from program records, not from parents. But we did. We asked every time we did a parent interview, and when we did parent interviews when the kids were 0, 1, 2, 3, and 4, 5, 6, 7, we did a 2-hour in-home parent interview where we collected all kinds of information, including information about a whole variety of services that they used during that year. And we did the same thing in the follow-up. Okay? Does that answer your question? Okay. Children from the Better Beginnings, in our Better Beginnings sample, reported more regular exercise than those in the comparison sample, 81% versus 72%, and lower reports by the youth of property crimes, 29% in Better Beginnings and 40% in the comparison sites. For parents, less alcohol consumption by parents in the Better Beginnings sites, less smoking in the home, not less smoking by mother. We found that at the end, in our short-term findings, we found less smoking by mothers in the short term, at the end of the 4-year period. That didn't last up to grade 12, but there was a report of just less overall smoking by all people living in the home. And lower rates of clinical depression reported by the parent, almost always the mother. And we had a depression scale with a cutoff that indicates clinical depression, and there was a lower percentage of clinical depression, and I don't know why we don't have that percentage up there. Do you remember what it was? Joanna had it yesterday. Something like 19 versus 12% or something like that. I'm sorry I don't have those percentages up there, but they're actually in the handout. If you look at the grade 12 results, in those summary reports, it presents the clinical depression percentages. Different. What was it?
18 versus 27.
18 versus 27. Okay. So 27 for the comparison sites, 18 for the youth themselves, viewed in terms of perceptions of neighborhood, viewed their neighborhoods as less deviant in terms of drug use, violence, and theft than youth in the comparison neighborhoods. And the parents rated their neighborhoods as more cohesive. They felt more a part of the neighborhoods. These follow-up data in grade 12 were only for parents that continued to live in the Better Beginnings or the comparison neighborhoods. If they moved out, although we followed them and collected all the information from them, we didn't collect this kind of information because they were living in all over Canada. Yes, question?
Parents who were involved in the programs originally versus those who weren't?
We looked at that initially and didn't see any differences, except for things like feeling more a part of the organization. But we didn't find any differential outcomes in these long-term effects. As to what the question was, did you find any differences between parents that were really actively involved in terms of resident participation in the programs versus those that were not? And we didn't see any differences, long-term differences here.
Look at where you were seeing a long-term impact. There's in the children and the families. It's around solving problems, so less clinical depression, less alcohol use. So it's more they had a problem and the problem got better. Did you have measures that were more asset-based? So looked at people's increasing sense of confidence or those kinds of things, and they just didn't light up, or did you not, or were most of the measurements around a problem or deficit?
Okay. Question was, most of the outcomes, the positive outcomes that I've presented here are reductions in problems, not increases in capability or capacity or positive, and was that a function of lack of measures of those, or was it a function of, oh, you measured it, but you just didn't see it? We measured it and just didn't see it. Now, that being said, we did not have nearly as many measures of positive outcomes as negative outcomes. We started this research in 1990. We started the outcome research in 1992, 93, where we were trying to figure out what measures we would collect, and we had to take it out to the various communities. We also had to take the protocols to the government funders. And we had to get approval from both. I mentioned this maybe yesterday, I'm not sure. We had to get approval from the research committees that the questions that we were asking were okay, but we also had to get approval from the three funding ministries. The three funding ministries in Ontario were Ministry of Community and Social Services, Health, and Education. And they had a group of people that were sort of their ministry representatives for this project. Well, one of the things that we had a measure of was marital satisfaction, whether or not the parents felt that they were getting along well with their partner. And we used the dyadic adjustment scale, which is a fairly well-known measure of how it's used in marital therapy and how well people get together in their marriages and so forth. One of the questions is, how satisfactory is your sexual relations with your partner? Well, the ministry representatives did not want to see that question in the protocol at all. They could just see red flags all over the place. But the research committee in Sudbury said that question has to be in. And one of the members of that committee was in fact a nun that was on the research committee, and she said that's the only thing that's important anyway. So you have to ask that question. We took that information back to the government, and they said, okay, if the community say it's okay, we're saying this is a community empowerment thing, and that was exactly what happened. But we didn't have a lot of positive. What I was going to say is that when we developed these protocols in 1992, 93, it was before the NLSCY, before the National Longitudinal Survey of Children and Youth. In fact, as we were developing our protocols, they came and talked to us about what we were finding. And over time, we tried to coordinate our protocols with theirs as much as possible in order to be able to use those data as a virtual comparison site. We couldn't do that because they don't have enough disadvantaged families in their samples, so we couldn't weight it appropriately. But anyhow, our measures were very similar to theirs. And if you look at the NLSCY measures, the parent interview, information collected about the child, information from teachers collected about the child, it's much more deficit-oriented than positive-oriented. But we had measures of self-esteem, we had measures of positive peer relationships, we had measures of social skills, and they just didn't show up. And that could have been because there wasn't enough emphasis or the programs weren't strong enough. Or keep in mind that for $800 a year, you're trying to provide, per child, you're trying to provide this range of programs here for parents, for children. And when you see the cost of a lot of the programs that are having impact, you can see that you wouldn't necessarily expect a whole lot of impact across a whole variety of things. It's not intensive enough to do it. We did not find any changes in parents' reports of how they parented their children, which is at the center of research on parent management, parent training programs. That's what you ask all the time. Did the child's negative behavior change, usually, and did the parents report dealing with the child differently? Did they move from highly punitive to much more supportive or whatever? We did not find any changes in parents' report of their way in which they dealt with their own children, but there was no intensive parent training program in any of the communities. None of the communities adopted the Triple P, which didn't exist then. None of them adopted the Incredible Years parenting program, which are very common now because it didn't exist then. I mentioned before, and so we didn't see any effects. It probably just was not intensive enough. There was parent support groups, there were parent education groups, but there was not parent training programs per se. I mentioned before that these 8 Better Beginnings sites continue to be funded by the Ontario government, and they have changed many of the programs they offer. We're following this one group of children as they move into adolescence and adulthood, but these programs are still operating for 0 to 4-year-old children and 4 to 8-year-old children, and increasingly they are adopting and implementing evidence-based programs. So Incredible Years in the younger sites is being adopted in most of them. They're much more intensive programming, much more focused because they're empirically validated or whatever you say, evidence-based. In 1991, evidence-based terminology didn't even exist. So, you know, it was just starting to percolate up through the healthcare system, evidence-based medicine, but it hadn't really hit the social service field the way it is now. Now you can't offer a program if it's not evidence-based, although we could talk about what constitutes evidence. And we may have seen some slippage on that in some areas, but at any rate. Did I answer your question? Okay. The third thing I talked about were costs, that we were asked to do an economic analysis. And this turns out to be, as far as I know, I'm willing to be corrected, the first and only long-term economic analysis of an early childhood development program. And what we decided to do was to take a very conservative view here by considering only government costs. So what we did is to calculate how much the government invested, I've already talked about that a bit, in these communities. But also we collected information about use of government-funded services. Okay? And there were 19 different indicators in our data that we could easily or relatively easily put a dollar figure on in terms of how much it cost for a visit to an emergency room, or if you're on public welfare, or if you're on Ontario Disability, or special education. If you're involved in special education, we could put a dollar figure on that because those figures are available. So what we did was to see whether or not the use of government-funded services by the Better Beginnings sample differed from the use of government services that are monetizable government services in the comparison site. Is that clear? Now, I mentioned before the cost, $748, should make that $830, $200 probably, just to round it off. It's easier to remember. Just remember $748 per child per year. That's what it cost. That was all converted to $205. The cost savings results. The cost, of course, was the government invested $2,991 over the 4-year period, adjusted to $205. But we also found that the Better Beginnings sample used more health care services than the comparison sample did. Now, we can argue if that's a good or a bad thing in terms of accessing health care services. But in terms of our cost analysis, it's a bad thing. They were using more government dollars, purely and simply. They were accessing more health care services. So that was an additional cost of associated with Better Beginnings. Clear? If we look at, that's the total cost of $4,000. If we look at cost savings that occurred in education for Better Beginnings, there were $5,316 less of education services used by Better Beginnings children than by comparison children. And this was primarily special education. Remember, there was greater use of special education. When we costed that out, the differential between comparison and Better Beginnings was $5,000 per child. If we looked at social services, there was a difference of $3,300 resulting from two things: greater use of welfare payments and greater use of disability payments on the comparison sites versus the demonstration sites. So there was a differential in favor of Better Beginnings of about $3,000 or $3,300. Less use of government services. When you put that all together, what you get is a total cost savings of about $8,600 per Better Beginnings family, compared to a total investment in government of $4,000, or a differential of, about $4,600. What that means is that for every dollar that the government invested in Better Beginnings, they recovered $2.50 on that investment by less use of government services by the time the children were in grade 12. Claire? And that comparison of 1 to 2.5 is reported by a number of studies now. In fact, if you look at the early years, the third early years study, is that what it's called, the early years study? There are a number of different economic analyses reported in there, and the savings are about 1 to 2.5, saving $2.50 for every dollar invested. Some of that is child care investment, different studies. Okay, now we're preparing applications for a grant to follow these kids up to age 25. We still have the sample maintained. When you do longitudinal research, as I've mentioned, you turn very quickly from a scientist to a detective or a sleuth, trying to keep in touch with your families. And they're moving all over the place, not just within the neighborhoods, but all over Canada, out of Canada, and you have to follow them up wherever they go. And so there's all kinds of ways of trying to track your longitudinal sample. We had continued to maintain contact with them. And so when the kids turn 25, we hope to be able to do telephone interviews primarily to find out whether or not any of these differences continue to show up. And there's reason to believe that, for example, there was this differential in terms of property crimes that I talked about before. If that ends up resulting in lower rates of incarceration, for example, that's where real cost-saving effects can start to mount. We published the results of our longitudinal study for children in the 4 to 8-year-old sites in the Monographs for Society, Research and Child Development in 2010. This journal is the highest rated developmental journal in the world in terms of impact factors. So, and you get 150 pages of text that you can write up your results. Well, you can see how complex Better Beginnings is with all these different aspects and with all the measures of children and families and so forth. To synthesize that all down to an 8-page journal article would be quite a challenge. Fortunately, we were able to publish our results in this monograph, so we could go into much more detail than you would normally go into in a single journal article. In addition to that, it's very important to have peer review credibility to the research that you do. Because if you haven't published your research in a peer-reviewed journal, it always remains somewhat suspect. And by the way, for those of you who are interested, the Perry Preschool Project data has never been published in a peer-reviewed journal, just as an aside. Okay, Better Beginnings today was cited by a number of organizations that have best practice sort of reviews. UNESCO, National Crime Prevention Council, Canadian Population Health Initiative. To summarize, Better Beginnings has long-term impacts on children, families, parents, and communities for children that participated in the 4 to 8-year-old programs, not long-term effects for children in the 0 to 4 for reasons that we discussed. It saves money in the long term, $2.50 by the time the child is 12. It's a Canadian study, and it's the first long-term longitudinal Canadian study with an appreciable sample size of an early childhood program that includes an economic analysis. It transforms disadvantaged neighborhoods into schools that serve them into places of hope and pride. There was a lot of evidence of this, a lot of presentations by parents. In the DVD, if you watch the rest of the DVD, you will see a lot of interviews with parents, a lot of indication of how Better Beginnings was able to really pull families, oftentimes out of isolation, into interaction, into community involvement, and really did transform those neighborhoods into much more positive places to live. And it's a way for agencies and organizations to become more effective in disadvantaged neighborhoods. The lessons learned in terms of integrating services, of how to deal with disadvantaged families that we got out of the research that we did is very indicative of that. So we have all this information. We have had an incredible amount of information about how these programs got up and operated, and how they operated for the first 4 years. once we got these positive long-term outcome results, we felt that it was time to try to make some of the lessons learned available to other community groups that might be considering or might be involved in similar kinds of initiatives or might be considering similar kinds of initiatives. So we had all of those reports of all the information we collected from 1991 to 1997. We already wrote reports of that. We got a grant to go back and look at all of that information and write up what we call a toolkit. A toolkit which is a manual for that describes all the different aspects of Better Beginnings, how the program's developed. The toolkit itself is about, the manual itself is about, how many pages? About 200 pages, 150 pages. We have a summary of the same material that's about 20 pages. Some of you may, did you get a copy of the summary? Okay. Which just summarizes the manual in about 20 pages, the basic information. And a DVD. You saw a couple sections of the DVD. That DVD, all of this information is available in French and English. The DVD runs, I think, overall about an hour and follows exactly the major topics of the manual. So it can be used in conjunction with the toolkit manual. We are now, once we developed the toolkit materials, we received funding to disseminate this across Canada. So we have a grant to take this information out to every province and territory, and today is BC's turn. This funding ends at the end of 2013, so by that time we will have been in every province and territory, telling you about the fact that this toolkit exists. If you want to buy it, it costs all of this, it costs about $70. If you go online, you can download it. It's all online. You can review it online if you don't want to buy it in a hard copy. And the main modules are the history and overview of the Better Beginnings project, developing your program model, research and evaluation, community resident participation, engaging community partners, project organization and management, and working with government and other funders. These are the main topics in the manual. These are the topics of the DVD. So if any of those interest you, there's a lot of information in the manual and the DVD about lessons that were learned with regard to, for example, community resident participation. A hallmark of Better Beginnings, but a very difficult thing to engender and to maintain. So the information that we have learned from our research is encapsulated in the toolkit. And I encourage you to take a look at it and see if any of it is. There's my contact information, which you can get from the website. And the important thing is down here in the bottom right-hand side, www.bbbf.ca. That we created a new website for all of these materials. We had an old website that we used for 20 years, I think, putting all our reports and everything on it. That's all been transferred over to a new website. You can go to www.bbbf.ca. You can download all of the toolkit information. You can see all of our research reports. You can see all of the reports that we've written and all the contact information you need.